Hi, everyone. It's Elizabeth Morosco with Kudos magazine, and today I'm with a special guest, Dr. Al-Qasmi, a neurologist at Hurley Medical Center, and he's going to share with us insight on stroke, including symptoms and treatment, and so much more. So, for starters, thank you so much for meeting with us today and fitting us into your schedule. We really appreciate it. Tell us a little bit about Hurley's certification to treat and help people that are possibly having a stroke.
We are a primary stroke center, meaning there's a lot of very strict criteria we have to meet when it comes to caring for patients with strokes. We have to get them to the CAT scan within certain time, which we meet, and we actually do better. We excel in that. There is certain time we have to offer the medication. We have all the physicians available on site to see them, speak with them, and make sure that the patient is on the right track for recovery. We always have a dialogue with our ER physicians, the neurologist, the stroke specialist, also with the ER physician to make sure that we have the plan in place, the appropriate plan for those stroke patients. So we are a primary stroke center, and we go through rigorous certification to get to that level. It's certified by the American Heart, American Stroke Association. Yes, so there's a body that actually looks into our activity and approves of what we do here, and we try to do a good job.
What is the difference between symptoms of a heart attack and symptoms of a stroke?
So we're going to talk about the common things between stroke and a heart attack. Both of them are because of a clot that occluded an artery. The only difference is that with a heart attack, the artery is actually in the heart, as opposed to with a stroke where the artery is in the brain. And by the way, there's actually two types of strokes. The clot stroke, which is far much more common, where there's a cessation of blood flow to that area of the brain, causing the injury. And then there's the bleed stroke, which is less common, and it happens because of an interruption of the integrity of the artery, so a breakup of the artery like an aneurysm or sometimes like a trauma.
What is a TIA?
Sure. It's actually a golden opportunity. TIA stands for transient ischemic attack. Some people call it mini stroke. Some people call it mild stroke. I like to stay away from the stroke terminology with TIA, because with stroke there is damage. With TIA, there is no damage. And up to 10% of people with TIA can go ahead and have a full-blown stroke, and that's why it is really a golden opportunity to prevent a stroke from happening. So if your beloved one suffers from a TIA, a mini stroke, make sure that they come to the hospital as soon as possible, because we need to check their heart, check their carotid, and change their medication so that the risk for stroke becomes much lower, and we can prevent a stroke from happening with a TIA. Again, it's really a golden opportunity to handle, to take. Also, it's an opportunity for us to rethink about our lifestyle, be it sedentary, be it that our choices in food is different, and our choices in exercise needs to be adjusted. So it's really a golden opportunity again. With TIA, as I told you, there is no damage to the brain, and we can do a lot. If you ever see somebody, your beloved ones, having symptoms, faces droopy a little bit, slurred speech for a bit, and then they're back to normal, don't say that's fine, they're okay now. Take them to your doctor as soon as possible.
What would be symptoms of a stroke's happening?
What I would like you to remember is how to be fast. The acronym BE FAST. B for balance, so people can have a balance issues. They're dizzy, they're not walking straight, they're staggering. The E is for the eyes, the vision. Their vision is off, not seeing correctly. F is for the face. The face is droopy. They have a drooping face, or the eyelid is kind of down. A is for the arms, so have your beloved one put their arms up, and if one arm drops down, then there's weakness on one side, and that can be a sign of stroke. And S is for speech. If they're slurring their speech, or you cannot understand them, which is unusual, then T is really for time. Time is of an essence. You have to bring your beloved one to the nearest ER, preferably to Hurley, obviously.
Of course. And actually, that brings an interesting point, too, for being able to determine if a stroke happened. I had heard with CAT scans, within a certain amount of time, you're able to do things to even prevent a stroke from going further.
That's correct, which is, again, B fast is T is for time. Time is of an essence. For every minute that is the brain is not receiving oxygen or sugar because of the stroke, there is a loss of neurons, and that loss is forever. So what's important is that you try to get them to the nearest ER, because there are medications we can offer for up to 3 hours, 4.5 hours, and only in few cases we can go up to 24 hours. But again, the sooner, the better.
So 3 to 4 hours,
4.5
possibly
hours.
24 after the stroke happened,
Correct.
that you can do this medicine.
Correct.
And does that help reduce the intensity of the stroke?
Yes, so the medication we give is called the clot buster, or TPA, and TPA dissolves the clot. So instead of having that blocked artery, it actually reconstitutes the circulation, so it opens it up. Now, sometimes up to 24 hours, if that doesn't happen and the artery is one artery that we can reach, then there's other procedures that we can do. But the sooner you get them to the hospital, the better.
Okay. So quick on your feet. And that
Absolutely.
can save lives.
Yep.
So with risk factors, sometimes it can be genetic. What are some other things that people could look at to prevent stroke, in terms of lifestyle or...
So in general, be healthy, right? Be healthy with your food. Make sure that your choices are correct. Be healthy with your activity. Activity is very important. Exercise is very important. Studies have shown that those who exercise at least 20 to 30 minutes 3 times a week, preferably every day, their risk for stroke, the risk for heart attack is much less. The risk for hypertension.
So that's some motivation to
Absolutely.
get up
Yes.
and start moving.
Yes.
Yeah.
Yes.
And I think one of the things people make a misconception about is it means that you've got to go to the gym and get crazy. There's simple activities you can do at home just to even be active, walking up and down the stairs. And
Absolutely. Even if you're sitting on your chair, and you're just moving your legs up and down, actually that is a form of activity that is good. Better than just not doing anything, basically. Also, hypertension. The most common modifiable risk factor for stroke is hypertension, high blood pressure. So it's very important that we keep a very close eye on our blood pressure and control it very aggressively. Our salt intake, we have to really be careful with that. Cholesterol. Very important to bring cholesterol down. And one thing I'd like to tell you, Elizabeth, at the time that we think stroke is a disease of the elderly only, this is not always true. Statistics have shown that 1/3, so 30% of people with stroke are under the age of 65. So
it's incredible.
Yeah, so you really want to be mindful.
It's a mind-boggling number. Because you do associate it where it would be more towards seniors that have it, that you wouldn't really realize that you could be having a stroke that young. That's why it's important, I think, to even start talking about some of the symptoms. Like with heart attack, they often talk about how it feels like an elephant on your chest. But being able
that's one of the things that actually kind of distinguish stroke from heart attack. With heart attack, usually there's pain. Not always with stroke there's pain, except if it's a bleed stroke where a headache can occur. But not always pain is associated with that. So many times people tell me, well, they didn't seem to be in pain. My dad, my mom, my uncle, my aunt, they didn't look like they are in pain.
Right.
So we didn't think much. But again, they were talking funny. We couldn't understand them. Their face was a little bit droopy.
And sometimes they can almost sound like they're drunk with the slurred speech. So telltale sign, too, if you have a loved one who hasn't been drinking and may appear like they're under the influence, it may be something.
It can be a little bit kind of vague, People are just confused a little bit. And again, if it's outside their norm, don't think twice. Just take them to emergency room. Have them checked by the doctor as soon as possible.
This is an oddball question, but what would be the difference between a brain aneurysm and a stroke?
So the aneurysm is actually the artery itself is bulging. Doesn't necessarily cause a stroke, but sometimes if the blood stays or there's a static blood in that area, then a clot can happen. A stroke is already a damage to the brain. An aneurysm doesn't always cause damage per se.
Okay. So one of the things I've seen is a happy stroke victim and sad stroke, and it doesn't necessarily have to do with just their emotions. Can you explain that a little bit?
Sure. So at the time, stroke remains one of the leading disability causes in the United States. It's the second causing of disability actually in the U.S.
I did not know that.
Yeah, there's about 800 cases of new strokes every year in the United States, if we're talking about the statistics. As a matter of fact, every 40 seconds in the U.S. somebody suffers a stroke, and every 3 minutes in the U.S. somebody dies from a stroke. So it's really not as uncommon as some people may think. It is rather a common disease. It's important that we recognize it, and it's important that we do something about it. The faster you get the patient to the hospital, the more things we can do. I've seen people who came in with complete paralysis, and they were able to walk out of the hospital because we were able to get to them soon to open the vessels with medications.
That's incredible. So being able to have recovery in the hospital without even necessarily have to do...
Yeah, sometimes people do that. Yes,
that's amazing.
It can happen.
Yeah.
The idea there is time. Time really is of an essence. So the faster you get your beloved ones to the hospital, the better the outcome usually is. Unfortunately, sometimes we're not very fortunate, and people continue to have weakness or difficulty with speech or even difficulty with memory after the stroke.
So after the stroke happens, and let's say that it's somebody that has something more serious, where it's affect them physically, maybe even their speech, maybe even motor skills, what are some options out there for patients and their family that are at that phase after the stroke has happened?
Unfortunately, at the time, the brain does not regenerate. So whenever there is damage to the brain, that damage is permanent. The brain is also clever. It tries to reroute itself, if you will. So imagine if there's an accident, say, in the middle of a highway. The cars behind are going to try to come around that accident, right, until it's cleaned up. And that's what the brain tries to do, rewire itself, come around that area that is injured. And that's something that requires time, requires physical therapy, and requires trained people in that area to actually show you the way, what you need to do. So we always encourage our patient never get discouraged and continue doing the exercises you're doing, be it for your speech, be it for your weakness. Just keep on doing as much as you can. The brain sometimes rewires itself, and people do get better on the long run.
That's amazing. That's hopeful. That's hopeful. So with practices like occupational therapy, speech therapy,
physical therapy,
those can help. So typically if a patient came through Hurley, and let's say that they had a stroke and they go through treatment here, they start getting better, upon release, where do you send them? Do you guys have some sort of physical therapy program here at Hurley?
So we do have physical therapy. We have a rehab center here in Hurley, and even after they're done with their rehabilitation, they're put through channels where they can see physical therapists also at home, and then they're shown those exercises.
Oh, that's wonderful.
Right?
Yeah, and especially when they're at that stage of they're still exhausted and recovering, to have them come right into the home.
Yes. So we always try to find the places that can help them, or send people to their houses that can help them through.
That's wonderful. That's wonderful. So is that typically covered by like insurance, or is that something? Okay.
Yes.
That gives us some hope too.
As you can imagine, different insurance have different policies, but we always try to work with them.
Right. Yes. That gives a lot of opportunity, I think, for even the caregiver to be able to have more support as their loved one is on that path of healing.
Absolutely.
Because it can be so overwhelming for them.
And it's actually one of the pieces in rehabilitation here, where occupational therapy go through the chores of the house, making sure that they're able to go up and down the stairs, or teaching them certain tricks, how to do things safely, going into the bathroom, outside the bathroom, handling the kitchen, all the daily chores, really. So those are things that, we rehabilitate the patients before we cut them loose.
And I think you don't realize those daily things that have an impact after a loved one has had a stroke, even standing in the shower.
Absolutely. And also on
like
their caregivers, really, the spouses, the family members around them. Yes, the impact is really huge.
Yeah, it does. It can actually turn into a full-time job.
It can, absolutely. Yeah.
So speaking of full-time jobs, your full-time job here at Hurley is a neurologist. So I'm actually meeting with a brainiac today. Yes. Which is, it's kind of exciting. Now, what made you decide that you wanted to go into neurology?
So the brain is really intriguing and complex, and we didn't understand the brain in the past a lot. We had lots of theories left and right, and it always intrigued me how the brain recovers, how the brain is injured, how the neurons speak with each other, communicate with each other, and really how the brain makes us what we are in terms of our ability to understand, communicate, speak, enjoy life, play sports. It all boils down to the physique, but also the brain, how we live our life, really. So it's very intriguing, and I was intrigued by the brain, and I chose to go to neurology, and then I did another fellowship in vascular neurology, stroke neurology, which is one of the areas that are really exciting nowadays. We have a lot of things to offer. I remember one of my mentors at Henry Ford, where I trained, who told me that back in the 80s, 70s, or before, when a stroke patient comes in, we would just tell them, okay, park them on the side, we'll get to them when we get to them, because there's not much we can offer at that time. Nowadays, when a stroke patient comes in, the ER is really up and running. Nurses are running left and right. The patient is, on the stroller, the same one that he came in with. We're going to the CAT scan back. We're mixing the medication. So there's a lot of things that we can offer nowadays, and it's a very exciting time in the world of stroke. We have a lot of recent research on stroke, on multiple sclerosis, on Parkinson's, on all the areas of neurology that are very promising and are exciting.
So in your profession, do you just look strictly at the stroke part, or do you also look at some of the other conditions that are tied to the brain?
In my capacity at Hurley Hospital, I am the director of stroke, so that is my subspecialty.
But on weekends,
I'm a neurologist as
I like to learn. Yeah, that's fascinating. And actually, that's the kind of doctor that I would prefer to connect with somebody that's so passionate that they're looking at, their specialty, but investigating these other things that are happening. That's where I think you get innovation and continual excellence in the care that you receive. So, no, seriously, a kudos to you for finding your passion and then bringing it back here to Mid-Michigan, because we do need more doctors that have a skill set combined with a passion. And it just gives me hope. Yeah.
Thank you, Elizabeth.
Yeah, sincerely. So if there were any tips that you could give to patients or caregivers on, especially afterwards, of things that they could do to help the healing process or to better communicate with their physician, what would you suggest to them?
So obviously the day-to-day chores, try to learn from your occupational therapist, physical therapist, the new exercises they give you, the new tricks they give you, and try to do them on your own as well. Frustration would be your worst enemy. We've all seen babies try to walk, right? What do? They fall.
Yeah.
And they fall again and again, and eventually they
walk.
And then they run, right? So keep on at it. The brain is resilient, the brain is clever, the brain tries to rewire itself. The other thing is that obviously be healthy. Exercise. Cannot emphasize it enough. Even if you're sitting down, watching TV, move the legs.
You're starting to sound like a YMCA thing. We're going to have to do that.
Well, it is good, actually.
It is.
It is healthy.
Yeah. Dancing can be exercise.
Yeah. make sure that you're eating healthy. You're watching your cholesterol.
Something I've heard recently is there's been more of a push towards Middle Eastern diets from especially heart doctors. So, I mean, is it the same
there is
kind of
actually
approach?
a diet called the Mediterranean diet, and then there's also the Lionheart diet.
I have not heard of the Lionheart.
So any extra virgin oil actually is beneficial. It kind of dissolves, if you will, the cholesterol, the bad cholesterol.
Really?
It is very healthy for the vasculature in general, including to the brain.
Right.
Antioxidants. So Mediterranean diet is, I'm not trying to promote any diet. Any diet
Oh,
is
I'm
actually
promoting
good, right?
it.
But
It's one of my favorites. I could eat it every night. Yeah.
we also recommend the Mrs. Dash's diet. It's actually also good.
Mrs. Dash, what's that?
It's actually low in salt.
Okay.
And you can see it. You can find it in grocery
Oh,
stores.
the seasoning,
Absolutely.
Mrs. Dash.
Yes.
I do know what you're talking about. Yeah, so if you want a little bit of zip without the sodium, that's the way to go.
Exactly.
Yeah.
Yes.
So there's no more excuses for not having great food and eating healthy. Yeah, just got to sprinkle a little of this and that, and especially being able to sprinkle in great medical treatment. So I am so incredibly grateful that you took the time to meet with us today. If somebody wanted to reach out to you, what would be the best way? Through like the Hurley website?
They can always go through the Hurley website and the hospital here, and we'll be happy to see them.
And we'll include those links in the description below. So if you want to get more information, you can follow up with that. So I am incredibly grateful for you taking the time to meet with us this afternoon. I know that you're very busy, and hopefully this message will resonate with someone, that it can help them along their journey. Because as you said, how many cases a year?
800,000 new cases every year.
800,000. That's almost a million people.
And I want you again to be fast. So remember those. B is for balance, E is for eyes, F is for face, A is for arm, S is for speech, and T is for time. Time is of an essence.
So, well, thank you again so
Thank
much.
you so
I
much,
appreciate
Elizabeth. I
it.
really appreciate
You have a great day. Thank you.
Thank you.
Thanks for listening, everyone. If you haven't checked out our Facebook page, you can check us out at Kudos Magazine. You can also find us at Instagram and on YouTube. All right. Thanks so much for listening, and make it an absolutely wonderful day.